Thank you. Welcome to Woman. I am your host, Valeria Penny, and today I have my special guest, Mignon Outlaw. Mignon is a registered nurse of 20 years. She's currently with Florida Hospital, which is right here in our own backyard, sunny Florida, Orlando. And what we're going to be talking about today is a new drug that is dear to her heart, and she's going to be sharing some information about this new drug with us today on our show. Thank you for coming on our show today, Mignon.
Thank you for having me, Valeria.
All right, well, let's get right to it. What is the name of this drug?
The name of this drug is called Uptravi. It's a medication that's made specifically for people who have what's called pulmonary artery hypertension.
And what is the generic name?
The generic name is called Selexipag, and it's actually made out of crystalline powder form, and it's put in a pill.
Mm-hmm.
So they take it actually pill form.
Okay, and you know I don't like pills.
Yes.
And who's the company that produces this drug?
Actelion is the company that produces it, and they created it, and it was FDA approved in December of 2015, which is just recently, and they're out of San Diego, California.
All right, and what is the pharmacology class?
The pharmacology class is called an IP and prostacyclin agonist, which means it creates an affinity for the actual drug so that the chemicals in this drug will help to open up the blood vessel at the cellular level to help increase the blood flow from the artery into the lungs, from the heart into the lungs by way of the artery.
Okay, and what are the current indications for use?
Specifically, they're using this medication for people who have that pulmonary artery hypertension, which is the high blood pressure, different from what's in your arms, but it's the high blood pressure that goes from the heart into the lungs themselves. So that it's like almost putting your finger over a water hose and holding your finger over it, and that back pressure is the type of pressure that creates that large amount of pressure in the lungs themselves.
Okay, and what is the current dosage strength?
It is 200 micrograms, and 200 micrograms, and they take 200 micrograms twice a day, once in the morning and once in the evening. Now, the highest dose that they can actually take is 1,600 micrograms twice daily. But they start off at 200 and they increase by 200 weekly until they get to the maximum dose. Once they get to the maximum dose, if the patient can't tolerate it, then they'll back it down and decrease it.
Okay, and how is it currently being supplied?
So it's supplied in a pill form, which is great because everybody else has to take their medications through an IV line. So it's a pill form. It's in a coated pill form. And the funny thing about it is that depending on what strength you can have a black pill, you can have a yellow pill, you can have a red pill. So it comes in all different forms, which is kind of fun.
Skittles.
Yes.
It's like Skittles.
That's right. So we tell people don't freak out, don't lose it if you get a different color pill. Just make sure that you check the dosage. That's the most important thing.
What are the contraindications?
So the contraindications, what they're saying is they're not really sure if it's safe for people who are pregnant, who are lactating. They're not sure about the pediatric population either. So anyone under the age of 12 is considered pediatrics. So they're not really sure if it's safe for them. If they have problem with their liver, they're not quite sure if it's going to be safe, and those with thyroid problems. So they want you to be careful if you have those conditions.
Are there any other warnings or precautions for this medication?
Yes. The warnings that they tell you to be careful is that it can cause anemia. It can cause you to have hyperthyroidism. So they want you to be careful if you're going to take this medication. And of course, before you take anything else, let your doctors know, your providers know that you're taking this medication, Uptravi.
Okay. Are there any other food or drug interactions?
Yes, there's one specific drug that they talk about. It's called Lopid, and it's for cholesterol. And because it can potentiate, which means it can make the medication be stronger, potentially be stronger, they want you to be careful if you're taking that medication. So if your doctor gives you Lopid, make sure you let them know that you're taking Uptravi, so that they can be careful.
Right. Because one of the things on our show, ladies, is to make sure that we're educating the public, making sure you understand the medications that you're taking, the drug interactions with other medications, that you are a well-informed patient.
Absolutely.
So are there any other type of adverse reactions at all?
Yes, some of the adverse reactions are headaches. They can have diarrhea. They can have arthralgia, which is pain in the muscles. Myalgia is muscle pain. joint pain. You can have flushing. Now, flushing is pretty bad, and it can be pretty rough because it's worse than a hot flash.
Yeah.
Because you have an increased flushing is an increased blood flow to your face, your hands, your upper torso, and you just get extremely hot and turning red.
Mhm.
So the flushing can be pretty bad. Most people don't like that part. It also can cause anemia,
Mhm.
so you have to check your complete blood count regularly. So those are some of the things.
Okay. And so you're on our show today, Mignon, because this drug is dear to your heart for a specific reason. So would you mind sharing that with us today?
Yes, I'll share that with you. I'm so sorry. I'm so sorry. Can you one moment? My mom, this is my mother. Her name is Juanita.
Mhm.
And she was diagnosed over 20 years ago with pulmonary artery hypertension. She's doing well, but one of the things on her bucket list is she wants to come off of this medication.
Mhm.
And she's been taking this medication through a central line, through a line that goes through her heart. And she's been doing that for 20 years. She stayed on this medication.
Wow.
And one of the things that she wants to do before she leaves this earth is she wants to come off of it. And finally, with Uptravi, she can go to a pill form.
Mhm.
She no longer has to, if she qualifies, she no longer has to be on that pill form. So my mom can come off of this medication and actually be on a pill form, and that will be a life changer for her.
So how will she know if she qualifies?
What they'll do is they'll do additional testing, and they'll try to add this medication to her regimen and slowly take her down off of the IV medication.
Mhm.
If it works and it sustains her pressures and her pressures aren't high in her lungs, and they do that by catheterization to find out if everything's okay, then she can come off that medication and go on the pill. So
Our hope
Very
is that
excited.
that comes true for her and that completes her bucket list
That
of
completes
items
it.
to do. So thank you for being on our show today, Mignon.
Thank
It was
you
a
for
pleasure
having
having you
me.
here with us. And thank you to our audience. As always, ladies, always look out for your bodies, your health, mentally, spiritually, and emotionally. Thank you for being on our Woman to Woman episode for this season.
thank you. Thank
Thank
you for
you.
having me. It was
Thank you.
wonderful.